All right. Well, hello. Good day. It's Amina Goodwin Fernandez, the infectious doctor, and I am a couple minutes late, but thanks for joining me. Uh, and I'm going to try and stick to the point because I get constructive criticism, which I appreciate, and sometimes I stray. So let's stick to the point. So we're talking about masks today. Um, and essentially, what's the big deal with masks for and coronavirus, right? So in the beginning, the first time I did a post on coronavirus several weeks ago, over a month ago, one of the things I said, which was the recommendation at the time, was that masks are not recommended for prevention of coronavirus infection because they're not good for more than about 20 minutes, et cetera, et cetera. And of course, this we all know is a changing situation, and there has been many changes since. So about 3 weeks ago or so, many healthcare facilities recommended universal masking. Basically, everybody on arrival, basically at the entry before you even enter the hospital, after temperature checks and so on, you are given a mask, and you basically wear a mask when out interacting with patients and so on. So that's what we do. And then about 2 weeks ago or so, the CDC basically recommended cloth masks or cloth-based coverings for the regular population. Essentially, the CDC wording is that they recommend cloth-based coverings in public settings where other social distancing measures are difficult to maintain, example, in grocery stores and pharmacies, especially in areas of significant community-based transmission. So that's the CDC wording for cloth face masks. Right? So, I mean, people just going to the park or, parks are closed, but if you're just kind of with your family, and just kind of, I guess, in the car, whatever, I mean, you're not necessarily going to wear a mask, but if you're going to go into the store, pharmacy, supermarket, and it seems like it's probably going to be crowded, you can't stay that 6 feet away, then wear cloth-based covering. But are masks the be-all and end-all of COVID-19 prevention anyway? Is it, okay, you wear a mask, you're fine, you're probably not going to get it? And the answer is actually no, right? And that's probably why the CDC in the beginning was hesitant to come strong with this recommendation for masks. A lot of people felt they should have done it long ago, but I think they were hesitant because there are more important aspects of infection prevention where COVID-19 is concerned. And also the fact that there has been a profound shortage of masks along with other personal protective equipment. So understandably, they didn't want it to be a situation where the masks were being used up by everybody, and then you didn't have them for the people in the healthcare environments taking care of actual sick people, and therefore those people needing it the most and not having it. So I think that was kind of why they didn't recommend it in the beginning. But now they're saying not recommending surgical masks for the public, but just cloth face coverings. Why, though, am I saying that the masks are not the be-all and end-all of COVID-19 prevention? Well, I have three reasons, or two main reasons. I think the most important is the fact that, the most important aspect of preventing COVID-19 is basically to avoid contact with a potentially infected person. And so that's where the whole social distancing or physical distancing thing comes in, where you try to stay at least 6 feet apart from somebody who's infected. 6 feet, when they do those studies about how far droplets from a cough or sneeze will go, it's about 6 feet. And so that's how they came up with that 6 feet rule. So essentially, the most important thing is avoid contact with a potentially affected person, stay at home. So many places have these kind of lockdowns going on, or stay at home or stay in place. I think it's a stay in place orders where you basically just stay at home. It's you and your family. And so in your little unit, there's whatever is going on in your unit is going on in your unit, and you're not going anywhere. If you do have to go somewhere, like some of us still have to go to work, or if you have to go to the supermarket or the pharmacy, then you stay at least 6 feet away from people. And thanks so far for those tuning in. Hi, Carla, Tanya. Hi, Anthony, Zanira. Hi, Zanira. Hi, everybody. Thanks for tuning in. Anyway, so yes, you might think you're wearing a mask, but the most important thing is just avoid contact with potentially infected people. And if not avoiding, you don't go near them at all, but if you have to be out, you try and stay at least 6 feet away from other people. The second, and probably an equally important, I should say, aspect of preventing COVID-19 is hand washing. Extremely, extremely important. Washing. And the point about hand washing is the fact that you touch the doorknob to go in, you push open the door, you touch a tabletop, you touch a phone, whatever. But any surface, if somebody who had coronavirus infection was in that area and they touched, they happened to cough in their hand or they touched their nose or whatever, and then they touched one of these surfaces, and we know the virus stays alive on surfaces to hours and days. And so if you come along and you touch a surface, you open the door, and before you were able to sanitize your hand because you maybe took a while, maybe several minutes or hours or whatever, and then in between, we involuntarily or unconsciously touch our faces, touch the mouth, touch the nose, eyes. And so if you are not washing or sanitizing your hands frequently, then you're going to touch your face. You're going to end up touching your face, your eyes, and you're inoculating yourself with the virus. And that is how you can get infected. So as much as you can wear a mask, but you can still be wearing a mask or cloth face cover and still touching and inoculating yourself, touching your nose, touching your eye, fixing the mask, kind of scratching your mouth or whatever. And so the mask will do nothing for you if your hands are dirty, touching even the outside of the mask with your kind of contaminated hands. And then when you subsequently, a few minutes after, you're kind of adjusting it, and then the outside of the mask gets contaminated, but you adjust it and it kind of touches your nose or whatever. And so without clean hands, the mask is of no use to you. Also, in terms of avoiding contact with people, you can be wearing a mask, but if you're in prolonged close contact with an infected person, just at you, and especially for people maybe out, I don't know, wherever, at the store, whatever, and you're standing close to somebody, even if you're wearing a mask, they cough on you or talk hard in your direction or sneeze, and then you can have particles, droplets coming into your eyes, or if the mask is loose and things kind of come down behind the mask. So it's really not gonna do as much. And I'm going to come back to some of these questions that I see here in a bit, so I don't lose my train of thought, but keep the questions coming. So masks, yeah, surgical masks do offer protection, and in the hospital we wear, like the picture I posted this morning, I wear surgical masks when I'm at work, when going around, doing my rounds, seeing the patients and so on. And good thing about surgical masks, they tend to have like I guess it's a wire or some kind of thing that you can kind of bend it right over your nose so you have a nice snug fit, and nothing, and you tie it so it's like nice and snug, so not as much gets in. So surgical masks, and the CDC says this as well, that surgical masks do offer protection against coronavirus. And of course, we are with more sick people, and when you're having that contact, kind of close contact, we're examining the patients and so on, having that close contact with a sick person, something like a surgical mask is what is recommended for us in the healthcare setting. Now, the cloth masks, which recently the CDC is recommending cloth face covering, and they say cloth face coverings are for source control, so they prevent the wearer from spreading infection. Okay, cloth face coverings, and this is the wording of the CDC website, they are not personal protective equipment, and it is uncertain whether cloth face coverings protect the wearer. So this is from CDC's website, okay? So for everybody, like in the community, and for us trying to get a handle on this whole thing, in the world, right? If we can have everybody covering their faces, like the nose and the mouth, where you're gonna have the secretions coming out. And so if we can have universally everybody covering, and so you are containing the source, right? You have a source control, and then the people wearing these coverings are not going to be spreading droplets with infection, and so hopefully that will ultimately kind of quickly decrease the amount of spread of infection and have us come back to some degree of normalcy. So that's the deal with the mask, and specifically the cloth face coverings. They are to control the source. So because we know now that people can have infection, like be infected with coronavirus and have no symptoms or no significant symptoms for them to think that they're sick. And so if you have to assume basically that everybody is infected, that's essentially what it comes down to. You assume that everybody's infected, and so everybody wears a covering, cover the nose, cover the mouth when going around, so as not to contaminate or infect other people. So of course, if you're wearing a mask, and I see this sometimes, this is out when you're out, you see people this outside the hospital and people are wearing a mask, but it's really loose, number one. Number two, people are wearing masks, but it's just over the mouth and the nose is not covered. Obviously, if somebody coughs in your direction, you're going to inhale those droplets. And so the mask is serving you no purpose. And then the worst one is that sometimes, again, out is not an hospital, but sometimes you see people wearing a mask and it's like on the chin or it's under the chin, and that does absolutely nothing. So if you're going to be wearing something, and the CDC says it's not clear how much protection it offers, depending on the type of mask, type of material it's made from, if it's nice and thick, and then there's some masks where you can put a filter in it. So there probably is some amount of protection from these masks, but you have to apply it properly. It has to be nice and snug, tied onto the face. If it's just loose or just partially covering the nose and mouth, it's definitely not going to help you. Okay. Also, if you're wearing a mask but you're not washing your hands, like I said, no use at all, because we unconsciously touch our faces. I mean, I think most of us now try to be more conscious of when we're not touching our face, but still, I mean, it happens. I'm sure it happens unconsciously to me. Also, if you're in a crowd, wearing a mask is probably not going to do much for you because you're close to people. It's crowded, especially if it's at close and there's not much circulation. And so, people coughing, moving, talking. We know about the talking. Last time I spoke on this, we spoke about a choir, people doing choir practice, and the fact that many of these people got infected from one person who was singing, they're belting out the tunes. And so if you're in a crowd, even if you're wearing a mask, it's just so closed that it's probably not going to do much for you. So the bottom line is the highest risk for infection, right, with coronavirus is sustained or prolonged close contact with an infected person. So as much as possible, the physical or social distancing rules will still apply. I'm not sure how long they're going to apply for, but probably for quite some time, because it is evident that coronavirus will be with us for some time. It's a new virus. Most of us don't have any immunity. And so, so as not to, I guess, overwhelm the healthcare system, it's going to be just kind of social physical distancing. And so if you're avoiding that prolonged close contact with a potentially infected person, that's the most important. Aspect for prevention. And then also, basically it's just staying at home. And then if you're going to work, staying at least 6 feet apart from people. So that's kind of what I wanted to say about masks. Essentially, if all of us cover our faces, or if we're going to be close together, can kind of wear face coverings. And then, just kind of keep doing that. And then we decrease the spread of infection. Those who are infected kind of contain it. And then hopefully this thing will go away and we'll get on with life. So let me just quickly go to some of these questions. Somebody said, thanks to these videos. This is Jacqueline. Given the realization that infected aerosol stays in air longer than realized, isn't some level of face protection necessary? People in supermarkets, pharmacies, or public spaces who speak, sneeze, cough, surely can infect other people who are practicing good hand washing. Yeah, so, and that's one thing as well that the CDC says. The CDC says airborne transmission over long distances is unlikely. So if, again, we say sustained. So someone can cough and some of the droplets go 6 feet ahead of them, but then you have potential like fine particles just that aerosolize it very fine, and they can spread for meters and meters ahead. But the further away they spread, so when you're close to the person, it's like the highest concentration. But then as it goes off into the distance, it's just more dilute. And then you have, most likely circulation of air. So it's felt to be very small likelihood of infection from these aerosols that disperse and just kind of float in the air. I mean, the fact is the air we have, even apart from coronavirus, they're like germs, all kinds of different germs in the air, but it's just really dilute, and you're not going to get like acute infection from just one or two viral particles that you breathe in, because after all, we do have an immune system. and it is to kind of trap germs that we may get exposed to. So I agree with this. I know sometimes people are skeptical with the experts and CDC because they keep changing and so on, but definitely I have no concern about the aerosol. Now, for people who are in the hospital setting, when there's certain procedures which definitely generate a lot of aerosols. So in the hospital setting, aerosols are, a big deal, depending on certain procedures. I'm not talking about me just kind of going down the corridor to see regular patients on the ward or on the floors, but like somebody who's doing a procedure on one of these patients, then for them, it's a big deal, and they definitely need that full protection, and there's special protection in the hospital, those N95s and so on. But just for the regular person out, and people have asked, I've had discussion before, people out and about in supermarkets and so on, the chance of being infected because of aerosols is going to be very, very, very slim. So that answers that. And then you're welcome, Helene. Thanks for watching. And Heather is watching. Hi, Sadia, Christy. Thank you all so much for taking the time. Somebody's saying, I'm a cosmetologist when we are allowed to go back to work, do you have specific recommendations for my profession since we work in people's personal space? I know we are to wash hands frequently and plan on wearing a cloth mask. I wasn't sure if you had any other further recommendations. So generally, and thanks for that comment and question, Carla, but I think the CDC, and it's kind of generally what everyone does, and you see it when you go into pharmacies and doctors' offices and so on, they're going to check. You're going to be asked questions, do you have any symptoms of any respiratory symptoms? Have you had a fever recently, or have you needed to take fever-reducing medicines, paracetamol, Tylenol, etc.? They're going to ask you if somebody in your house recently was diagnosed with COVID-19, or something of the sort. So basically, it's probably going to be a situation going forward when we kind of get back to normal, where for services, you're going to have to ask those questions to people to get an idea of the risk, right? And then it might be a situation where for people's personal preference, they just said, look, because I'm going to be so close to you, I think it's best that we both wear a mask. I think that makes sense, that for both people to wear a mask because you're so close. And again, breathing, sneezing, talking, you can potentially have a little virus coming out. So wearing a mask is probably going to be a thing going into the future somewhat. And then just kind of screening with questions to get an better idea of how likely it is for that person to be infected or have lingering infection or silent infection. So I think everybody will have their own kind of recommendations. Many different societies for different fields, different specialties have their own guidelines, but I generally, being close, probably best assume the worst, and two people basically contain their secretions. I contain my secretions, you contain yours, because we're going to be within feet of each other. And then if there's any hint of any symptoms, probably defer the procedure, postpone whatever procedure or beauty treatments or whatever. So that's probably going to be the best. I hope that answers your question, Carla. Okay, how not to wear a mask? Yeah, over the whole face, not just on the mouth, not on the chin. Radiation safety, time, distancing, shielding. I'm not sure what's apply here. I'm not sure what that is. Cindy, rules for radiation safety, time, distancing, shielding. Anyway, prolonged close contact with a person who's infected is the highest risk. The longer you're with them, and even actually, there was a study that came out yesterday, the Morbidity and Mortality Report Weekly from CDC. They put out reports, and they actually looked at a situation where there was transmission in a healthcare setting in California, where they had a patient, this early in the epidemic in February, they had a patient who had coronavirus, and nobody knew, and the patient was there for like 4 days and very sick. And of the 121 people, healthcare workers, who were exposed to that patient without any protection, 43 of them got symptoms, and they tested all of them, and only 3 of them tested positive for coronavirus, all right, for COVID-19. So of 121 exposed in the healthcare setting, no extra protection, only 3 tested positive. Now, of course, maybe you can have some false negatives, etc. But 3 out of 121, if you say maybe there are a couple that they missed, you can see that the likelihood of infection is still relatively low speaking. It's not like all of them got it. So that kind of gives you an idea of, the situation, and the fact that we don't have to kind of panicked because, oh, we went into the pharmacy and we heard that somebody who was in there coughed, and you're worried about the aerosols in the air. It's really not likely, right? So that was pretty interesting, that point. Now, let me see. Should we be wiping down groceries when bought in our homes? My husband does that. Well, he wipes on the grocery bags and takes things out and so on. I mean, I know a lot of people are suggesting that. A lot of people are wiping down basically everything. I mean, I think when the groceries are on the shelf, if you're packing your own groceries, and for the bags, I would probably take them carefully out of the bags and kind of lay them on an area and throw away the bags, and then where the bags were resting, probably just kind of wipe the counter properly. But in terms of wiping down each individual packet and bottle, personally, I might not. I probably wouldn't do that, right? But then when you're preparing your food, you're going to be washing them before you're eating. You're going to wash your hands. You're going to wash your hands. So in food preparation, you're going to wash your food. You're going to wash your hands. So I think you're going to be cleaning things anyway. So I'm not sure about wiping out every single thing, but I'd probably just throw in all the bags and then kind of be careful about wiping the surfaces. And when I take out the food, put them in a separate clean area, etc., etc. Okay. Let me see what else. Okay. Oh, Cindy. Okay, Cindy. Groceries. Oh, Heather's asking about the groceries. Yeah. There are germs everywhere. Like, I'm the original germaphobe. So generally speaking, I mean, I just think just washing your hands. I think when you buy your groceries, if something, like, sometimes the cans and so on are obviously dirty. If something is visibly dirty, like at the top and so on, I mean, you're going to clean visibly dirty things. But literally wiping down every single thing, I personally don't think it's feasible, because I think we're going to be washing our food before we prepare it anyway. And you're going to wash your hands and so on. Oh, hi, Julie. Thanks for your comment, and thank you all for listening. And I think we probably went pretty long, 22 minutes, and since I'm not trying to take up too much time. So I thank everybody for watching. And again, we're wearing masks to kind of contain our own secretions and hope that this will all level out. Going forward, washing our hands is the most important, most important, washing our hands. And for now, while we have ongoing spread, especially depending on the area you're in, staying away from people at least 6 feet. And then the last thing, which I always end by saying, is that we all have to try to optimize our health as best as we can, eating more nourishing foods over less nourishing, and trying to exercise and keep our bodies fit and toned and so on, so that if or when, because we're probably all going to end up, well, many of us are going to end up catching coronavirus before they get a vaccine in 1.5, 2 years. So we want to be strong and able to fight this infection off as much as possible if it happens to us. So again, thank you all for watching, and let me know if there are any questions in the future, whatever, any idea about a topic for me to go over. So thanks for your time, and everybody stay safe and enjoy the rest of your evening.